Today, let us discuss about proton pump inhibitors. Proton pump inhibitors are medicines that work by reducing the amount of stomach acid made by glands in the lining of your stomach. It relieves symptoms of acid reflux. It is used to treat duodenal ulcer or stomach ulcers. It is used to treat damage to the lower esophagus caused by the acidic reflux. Proton pump inhibitors are commonly used for the treatment of gastroesophageal reflux disease, Zollinger-Ellison syndrome, duodenal ulcers, stomach ulcers, peptic ulcer caused by anacids, helicobacteria, which is a gram-negative bacteria which causes peptic ulcers. In such cases, proton pump inhibitors are used in combination with certain antibiotics in order to give symptomatic relief. Erosive esophagitis, and to maintain healing of the erosive esophagitis, proton pump inhibitors are used. Mechanism of action. They block gastric acid secretion by irreversibly binding to and inhibiting the hydrogen potassium ATPase pump that is present on the luminal surface of the parietal cell membrane. All proton pump inhibitors are prodrugs as their active entity is a sulfonamide cation which is present in the gastric parietal cells. In parietal cells, they undergo molecular rearrangement. Proton pump inhibitors and sulfonamide make a covalent disulfide bond with the SH group of the proton pump, thereby inactivating it irreversibly and shutting off the acid secretion. Carbon dioxide from blood vessel enter into the parietal cell of the stomach and combines with the water, result in the formation of carbonic acid, which is then hydrolyzed into H plus ion plus bicarbonate ion which is again pumped into the blood vessels. H plus ion with the help of the ATPase pump, with the help of hydrogen ATPase pump, it is pumped outside and then it is combines with chlorine, result in the formation of hydrochloric acid, which is responsible for digestion of food materials. In case of proton pump inhibitors irreversibly bind and inhibit the hydrogen potassium ATPase pump, which results in the decreased segregation of hydrochloric acid. Proton pump inhibitors: omeprazole, esomeprazole, lansoprazole, rabeprazole, pantoprazole. Doses and diseased conditions. Bioavailability of omeprazole is 55%, esomeprazole is 70%. In case of duodenal and gastric ulcers, dose is 20 mg OD, 40 mg OD. For esomeprazole, dose is 20 mg OD, 20 mg OD. For GERD, dose is, for both cases, dose is 20 mg OD. For anacid ulcers, dose is 20 mg OD and 20 mg OD. For Zollinger-Ellison syndrome, in both cases, dose is in between 60 to 120 mg daily. In case of H. pylori eradication, dose is 20 mg OD or BD for both cases. For prevention of recurrences, 20 mg OD is preferred. This therapy is given for 6 to 8 weeks in order to get the complete effect. Lansoprazole and pantoprazole. Bioavailability of lansoprazole is 85%, pantoprazole is 77%. Duodenal ulcers, dose is 15 mg OD for lansoprazole, 40 mg OD for pantoprazole. Gastric ulcer, 30 mg OD for lansoprazole, 40 mg OD for pantoprazole. In GERD, lansoprazole 30 mg OD, pantoprazole 40 mg OD. In anacid ulcers, lansoprazole 30 mg OD, pantoprazole 40 mg OD. In Zollinger-Ellison syndrome, dose is 60 to 120 mg daily for lansoprazole. For pantoprazole, dose is 40 to 240 mg daily. H. pylori eradication 30 mg OD or BD. For pantoprazole 40 mg OD. Prevention of recurrences 15 mg OD for lansoprazole, 40 mg OD for pantoprazole. Rabiprazole bioavailability is 52%. For duodenal and gastric ulcers, 20 mg OD is preferred. For GERD, 20 mg. For NSAID ulcers, 20 mg OD. For Zollinger-Ellison syndrome, 60 to 120 mg daily. For H. pylori eradication, 20 mg BD. For prevention of recurrences, 20 mg OD. Doses are taken based upon the condition. Proton pump inhibitors are selected based upon the patient's diseased conditions. Adverse effect: headache, nausea, loose stools. Proton pump inhibitors inhibit the absorption of vitamin B12 on prolonged use. They decrease calcium absorption and may aggravate the osteoporosis. Gastric acid serves as an important barrier to bacterial colonization of stomach and small intestine. Hypochlorhydria produced by proton pump inhibitors increase the risk of enteric infections due to Shigella, Salmonella, and by bacterial strains that have potential to convert ingested nitrates into carcinogenic nitrites and nitrosamines. Drug interactions: a decrease in gastric acidity due to proton pump inhibitors may decrease the absorption of some drugs like ketoconazole and digoxin. Omeprazole, esomeprazole, and lansoprazole inhibit CYP2C19 enzyme and CYP3A4 enzyme. Therefore, this increases the effect of warfarin, phenytoin, carbamazepine, and benzodiazepine by decreasing their metabolism. Lansoprazole may enhance the elimination of theophylline. These are contraindicated in patients with hepatic impairment, metabolic alkalosis, hypocalcemia, in case of pregnant women. In patients, those are hypersensitivity to the drug. Patient counseling. Advise the patient to take drug on empty stomach because it will increase the effectiveness. Advise the patient to take domperidone because proton pump inhibitors generally triggers the chemo trigger zone, which results in the inducing the nausea and vomiting sensation. In order to prevent this, generally prescribe domperidone to take this drug on these conditions. Advise the patient to avoid alcohol and food that may cause an increase in the GI irritation.